The goal of Artesia is basically, to tell you the truth, is just to serve. Serve the citizens of this community and provide great healthcare.
As a hospital, we don't like to turn people away. We have pretty much everything that like a big hospital would have. We have open MRI, we have the closed bore MRI, and then CT. We literally have everything here at this facility that you would have at a big hospital. We do it so people can stay with us versus traveling further.
A lot of the upgrades were necessary just because of aging equipment. As equipment ages, technology obviously advances, and it's only the right thing to do for our patients. With the upgraded CT and new MRI, image quality was huge. Speed of the exams became important. As we saw volumes increase both on our outpatient side and in our ER, a lot of our patients were having to go outside of Artesia or Artesia General's reach because of the different type of exams they were needing, claustrophobia. The need for an update was huge. Our XR Fusion C-arms, great addition to our surgical suites. Flat detector panels, sharper imaging. We don't get as much distortion as we used to. Time we can upgrade our equipment, as a department, we feel very proud. But the coolest thing is watching our patients feel the same energy when they come in to see this new equipment, because they have had to travel outside of the area to go get some of this technology that we have right here. It is pivotal for keeping not only imaging services alive, but keeping our patients in our family practices, in our multi-specialty clinics and different things like that, because patients have a choice. Our patients can choose also to go elsewhere because of those technologies. And if we're able to keep that here, and we provide that amazing customer service that we routinely do, then our patients stay at home with us. We keep that in the community, and that, again, is about building that relationship and trust.
It just makes it easier on patients. They don't have to travel, they don't have to commute, they don't have the gas money, it's all here, it's all local.
Small town, rural, small medical staffs, small communities. You can't beat it. This is like, the 𝗫𝗏𝗙𝗂𝗫. And so for us to sit here and say, hey, here we are in rural southeastern New Mexico, and we have a unit that maybe, 6 or 7 other facilities in the country have, hey, it's amazing.